Hello, everyone, and welcome to the Masters of Public Health and Community Health Education information session. I am recording this fall 2023. That should be helpful for those who are interested in applying to the program for fall 2024 and beyond. So welcome to this recording. I hope that this recording provides for you pertinent information for you to start your application process and also answers questions for you. On this slide, you will see the agenda for this particular talk. I will cover details about the MPH degree, admission, and the application process, followed by our frequently asked questions. So my name is Dr. Bobbie Emetu. I am currently the interim graduate coordinator for our in-person MPH degree or MPH program in community health education. And to your right is Dr. Susie Spear, who is the graduate coordinator for the MPH program in community health education, stateside or in person. Dr. Spear is currently on sabbatical and will be returning back in the spring. So I, as the interim coordinator, I am the one recording this, and I am the one that you will reach out to if you have any questions for the remainder of the semester. However, Dr. Spear will be taking over come spring 2024. So when we think of public health, it's important to know that public health is both a science and an art. And I really like this definition of public health in that it is the science and art of protecting and improving health through education, promotion, prevention, and research. And based on our program in community health education, we really do focus on aspects of research, health promotion, disease prevention, and also aspects of research. And in terms of the basic competencies of public health professionals, some of those competencies include assessing needs, assets, and capacity. So if one was to do a needs assessment, that is what they would be doing. Planning health education programs, which is one of the hallmarks of our program. We also do teach students about implementing health programs, conducting an evaluation and research as it relates to health or as it relates to evaluating some of those health programs. And we do also expand education about how to administer and manage health programs and how to serve as a health educator and a resource, and also how to communicate and advocate for health. So within all of the basic competencies of public health professionals, our program does a good job overseeing this and communicating this to our students that are part of our program. So the MPH degree is the most common graduate degree that one can obtain in the public health field. And typically one can be trained in some or one of the 5 core areas of study. And the core 5 areas of study is going to be biostatistics, epidemiology, environmental health science, health services administration, and social and behavioral sciences. So the 2 concentrations that we actually have at CSUN is we have our degree. We have a applied epidemiology degree, and then the other degree that one could obtain would be our degree in community health education, and that falls under social and behavioral sciences. And individuals who have an MPH degree are typically eligible for most jobs that are in the public health field. And one thing that is wonderful about our MPH program is that it prepares graduates for leadership and management roles in a variety of public health settings. That means individuals that are graduating from our community health education program are trained to work in a wide array of disciplines and settings. This might include local, state, and national public health departments, health-based nonprofits, community-based organizations, clinical and patient education, health advocacy. Some work at sites that really promote health promotion, or we have students that go on to work at school or academics or even in research, as well as private and professional settings as well. So of course, this list is not exhaustive, but we have many graduates that go on to work on places such as student health centers, AIDS Project Los Angeles, for example, Kaiser Permanente. There's many different locations that we have some of our graduates have pursued employment there. Los Angeles County Department of Health Services, or Los Angeles County Public Health, for example, Divinity, Northridge Hospital, or Dignity. So we have students that go to various locations after, they have graduated from our program. And here are some examples of job titles that some of our students have obtained when they have maturated into their job at hand. So some, and I'm not going to read it all, but some might be healthcare administrator, community health worker, health department administrator. Some, even students who graduate from our community health education program, might go on to be epidemiologists. If students would like a little bit of both, I've seen students take courses that are related to community health education, but then take electives that are related to epidemiology. So we do have students that go on and become epidemiologists or field investigators or research analysts. But I know that one job title that we see a lot of our students go into might be health education specialists, for example. And taking that example as a health education specialist, it's also important to talk about, wages that students typically might have, once they go into their field of study. And it's important to note at entry level. So entry level might be someone who has a bachelor's degree. Entry level might be 37,000 roughly, or 45,000 roughly. However, with a master's degree, that really does put people beyond that 50 percentile. So typically starting out, one might make anywhere between that 60,000 to 81,000 starting out. And we do know that you can see the higher end of that might be typically 106,000 a year. And this is coming from the US Bureau of Labor Statistics. So because just having a master's degree is not really an entry level, it positions people where people are making over that 60,000 and above. And so on average, most people might start out around that 60, 81,000 once they start their career. And of course, there will be opportunities to get ahead and people will be promoted. And that's probably where you really see a lot of this tail end of 106,000 over time. So our program is accredited by the Council on Education for Public Health, called CEEF. And CEEF is a program that accredits most of the public health programs nationally. And CSUN is accredited by the Western Association of Schools and Colleges, called WASP. And our program is the first accredited MPH program in LA. And not only that, is the longest accredited MPH program among all of the CSUs in California. So our program has been accredited more than 50 years. And in terms of community health education, we have an online program. We also have a traditional program. And when I talk about the traditional program, I'm going to talk about in-person. So for example, I'm the interim graduate coordinator for the traditional in-person program. We also have an online program. The online program is within CSUN, but it's part of a separate college called the Same College, and they have a separate application process. So if you are interested in that program, it's probably best to type in MPH Seng College, and Seng is spelled TSENG, Seng College, and that will take you to that program and information about that, and you can kind of see how you can apply to that program. That is very different than our traditional program, which is our face-to-face program. It's important to note that the online program has a cohort model, so people will be cohorted, and typically in our traditional in-person program, typically you can take students anywhere from 2 years to 3 years to graduate. 2 years if they're full-time, 3 years if they're part-time. But for the online program, it's roughly about 2.5 years for people to complete the program. And if you are interested in our traditional in-person program, which is what I'm here to talk to you about today, then of course you will have to apply through CSU Apply, and I'll talk about that a little bit later, and then go into Cal State Apply or Apply Web. Apply Web is where you would go in order to submit all of your materials through our department, but I'll talk about that in a second. And that means that our traditional program, our in-person program, tends to have more face-to-face courses. So in terms of the two concentrations that we have, as I talked about, we have community health education, which is primarily what I'm focusing on in this info session. And with our community health education, we have our in-person program, which is primarily the premise of this info session. But then we also have our online program. And as I mentioned, that's through the same college. But our in-person and our online program have the same mission. It's virtually the same program, except one is fully online, and then we have our in-person. And then our other degree program is going to be applied epidemiology. And I thought it would be really important to just really discuss the differences between these two programs. So when you look at community health education, the mission is to prepare professionals, right, to plan, implement, and evaluate health education programs. And the idea behind this is to enhance the general health and well-being of diverse human populations and communities. One thing that I would like to say about CSUN, and we really pride ourselves that most of our programs really do focus on the diversity of people. So even within our public health program, we do focus on not only health, but just diverse populations as well. So for example, my research focuses around sexual health, but I do a lot of sexual health as it relates to the LGBTQ plus community. And I know we have faculty member that focuses on racial relations, racial diversity, just different groups and their different needs. But as you can see here, the hallmark of community health education is to plan, implement, and evaluate. And that's really the hallmark, or really the basis of the program in terms of the classes that you will take and the skill set that you will learn that you can take with you and be successful in the public health field. That's a little bit different than the epidemiology or applied epidemiology program, where it really deals more with problem solving, critical thinking, and using technological skills that will allow students to assess and implement and evaluate programs. And again, in diverse human populations, which is, I would say, across the board at CSUN, our theme. But here you can see technological skills. So technological skills are going to be being proficient in statistics, being proficient in epidemiological strategies, learning different softwares like SPSS, SAS, Data, R. We do have electives that do rotate which packages are learned, but definitely developing some of those skills in order to be successful. And those skills are going to help students learn how to assess and implement and also evaluate programs, and really follow the trend and really understanding how, using technological skills, those trends in health systems and health disease and illnesses can be pretty much learned, and strategies can be further came up with or could be further expanded in how to help the population even further. So in terms of program requirements or course requirements, there are 42 units total. So it's important to note that 3 units equal 1 course. So that means that 42 units is equivalent to 14 courses. And in terms of the public health core classes, we have health behavior, biostatistics, research methods, epidemiology, environmental and occupational health, and health administration. Plus, you are required to take community health education core courses, which would be 9 units, electives, which are another 9 units, and then you'll have a communating experience. This is part of the internship. So this is where students have the opportunity to really hone in on a real world perspective. That means the field work will give students the direct and practical experience within the public health sector. And it's an opportunity to work with faculty or work with experts in the field and to get an idea how the public health work is done and how it's done correctly. And then lastly, students will either complete a graduate project or a thesis. Most of our students in community health education generally go through the route of doing the graduate project. However, for students who are interested in a doctoral program after our master's program, they might choose to do a thesis. A thesis isn't compulsory, but some might if they want a more rigorous research kind of experience. And like I talked about, we've had community health education students who also want to have a strong epidemiological background. So those individuals will, most of their electives will be taking courses in biostatistics, advanced biostatistics, or even electives as is related to biostatistics. And those individuals might choose to do a thesis in order to really hone in on that research experience. So it's really, the world is one's oyster when it comes to how you want to plan your program and develop your program. We definitely have students who want to focus more on health communication, so they might take classes related to that in terms of their electives, or students who might want to focus more on cultural issues, and they might take electives that are related to that as well. So there's really flexibility for students to really make their community health education degree what they really want. So we do have a carefully crafted curriculum. As you can see here will be most of the classes the students are required to take. So students will be taking a class in health behavior theory, which is the advanced concepts of health behavior, and then followed by program planning and evaluation. And after that will be curriculum development, how students will learn how to develop a curriculum as it relates to program planning and also evaluation, followed by community health action. Students will learn the importance of including stakeholders, partnerships, coalitions, and using that as a driver in terms of creating programs and overseeing programs to make sure that they're successful. Also, students would take a class in epidemiology to learn those skill sets. And then, of course, more skill-based classes, research design and biostatistics. And students will take one class on administration, supervision, and consultation, which is important as one is overseeing health behavioral programs. And then students will take a course on environmental and occupational health, again, kind of honing in on the pillars of public health. And then students will also do their field training, as we talked about, the culminating experience, which has a requirement of 300 hours. We have excellent internship proctors that really place students and help students get placed in various sites. And we have over 100 sites that we work with in terms of our liability and making sure that students can be adequately placed. Also, we have students who choose to work with faculty members on their research. So if as I talked about, we have students that might want to do further research, take electives that are related to research, might want to do a thesis. Some of these students might go on further field training, work with some of our many faculty members who are doing awesome projects, who have grants as well. So that's also an option for students. And then lastly, as I mentioned before, would be the graduate project or a thesis. So students can choose either or. And of course, there are 9 electives, and this is just really, I'm sorry, not 9 electives, 9 units of electives, so pretty much 3 courses. And this is an opportunity where students can kind of make the program what they wish to make it for themselves, maybe have a deeper level of expertise on a certain, topic or a certain selection of various elements or components. In terms of our faculty, we have about roughly 15 full-time faculty members. So that works out to be approximately about a 1-to-10 faculty to student ratio. So that's typically about 1 faculty member for every 10 MPH students. We have fantastic faculty that are doing wonderful projects. Many of our faculty have expertise in epidemiology, community health education as well, health disparities. Myself, my expertise is in HIV and STI prevention. A lot of the work that I do focuses on that. I pride myself that a majority of my publications that I have published at CSUN have incorporated students. All of my students who have worked under me for, doing their thesis have all pretty much published their work in peer-reviewed articles that are very well renowned or are in the process of doing that. And then, so for example, Dr. Spear, who is our graduate coordinator who's on sabbatical, will be coming back in the spring. Dr. Spear has done various projects have received grants as it relates to substance abuse, misuse, and how to navigate that amongst various populations. So that's really exciting. And then also too, we have faculty doing cultural-based work, racial sensitivity work. So we have so many faculty that are doing really awesome projects, and it's great for students to, work with them or get a grasp of what they're working on. And it's also great that students, when they take classes with them, they get to learn a little bit more of their work. So we really pride ourselves as a faculty about how diverse we are with the caliber of work that we do. So moving on to applications and admission. So we only have fall admission. We do not offer admission any other time. So that means no spring admission. All of our applications should be conducted online. So that means we're not accepting any hard copies or anything mailed over to the department. So everything should be done online. The application is now open for fall 2024 admission. So it's been open since October 1st. And be mindful that the application should be completed. The application deadline is May 1st. However, we do have a priority deadline of December 1st, so we still have a little bit of time before December 1st. So if you would like to get your application in early, you can do so by December 1st. And in terms of priority application, what that means is that you will have your application reviewed a lot quicker, and you will find out if you're accepted into the program or not. And if you do state that you would like to, that you do intend to come, there will be a seat reserved for you. So in terms of that, so the earlier you get your application, the earlier your application is reviewed. So it's to one's best best component, or best fruition to possibly get that in as soon as possible. But it's okay if you are not able to get that in by December 1st. Be mindful that the deadline is May 1st in order to be considered. So what that means that all letters of recommendation must be in, the application, all the fees, everything that's required must be submitted by that time. So if one is not able to get everything in by December 1st, they shouldn't worry. We really do review applications on a rolling basis. So really it's kind of first come, first serve in terms of reviewing the application. So in order to go in to find out, application details, here is the website here. So you can take a screenshot if you would like at this point in terms of the website. Or you can just go to Google. You can literally Google MPH, CHE, application, or apply, and it should take you directly to the site if you are able to Google that. So I'm going to just make this a little bit bigger here. So this is what our website looks like in terms of how to apply. And the first thing is, if you look on this left sidebar here, you will see the how to apply component here. So this will take you to a list of information about how to apply. And also the website does also reminds everyone that our priority deadline is December 1st. And then our final deadline is May 1st. So that information is there for you. But also this is, excuse me. Also down here, this is the area where you can really see the steps of how to apply. So step one is that people will apply to Cal State. Apply because you have to literally apply to the CSU system. And so you do that through Cal State Apply. So this provides direction of how to actually apply to Cal State Apply. And then the second thing is going through Apply Web and submitting all of your application materials that are required. And I will go through that in a second. So as I mentioned previously, we'll start reviewing applications December 2nd for those who already submitted an application by December 1st. And that means if you have submitted all of your materials in a timely fashion, we have all of the information where we can start reviewing that. However, again, the deadline is May 1st. So that means if there are missing letters, if there are things not submitted on time, like May 1st, 5 p.m., then unfortunately the application will not be considered. And be mindful, part of the application process is making sure that you have letters of recommendation, 3 letters of recommendation. And sometimes it does take referees a little bit longer to submit the letter. So be mindful of that. And so you want to make sure you get your application as early, get it in as early as possible. And this way that gives your recommenders or referees, that gives them time to get your letters in. Okay, so in terms of what you'll need, so you'll go into Cal State Apply, right? And you'll fill out the application and you will go through the application process. I know your official transcript will be submitted there, but just overall in terms of what you'll need a statement of purpose, right? And there are prompts on our website. So our website definitely gives you prompts to follow. So please read through that very carefully. You'll need 1 unofficial transcript. That means you will scan that and upload that, right? And sorry about that. You will also need an official transcript, and that will be submitted directly to the CSUN Office of Admission and Records. You could also do an e-transcript. They also do accept that as well. I know a lot of universities are doing that now. Then you will also need to submit your resume, followed by 3 letters of recommendation. And in terms of the 3 letters of recommendations, we really do require that one of those letters of recommendation is from an academic instructor. So let's say you've been out of school for a long period of time. It's okay. I understand if you don't have an academic instructor, but the goal is that you address that in your letter. You know, you've been in school for a long period of time. Maybe academic instructors might not remember you, but if you can, the expectation is for one of your letters to come up from an academic instructor who can speak on your skill set and the type of student you are in the classroom. You may also need GRE scores. So GRE stands for the Graduate Record Exam. A lot of universities do require this, but we require the GRE if an applicant's GPA is less than a 3.0. So if one's overall GPA is less than a 3.0, we do require a GRE. Or if the last 60 units a person took for their undergraduate degree is less than 3.2. So in that case, then one would have to take the GRE, and they must score in the 50th percentile in 1 or more sections, okay? And when one takes the GRE, they can send the official report directly to the university's Office of Admission and Records. I know when one takes the GRE will say, where do you want to send this? And so you can send this to our university. Our university code is 4707. So you can then add in that number, and they will know that they should send that to CSUN. So, you know, keep this number. That is the number that you can use in order to put before you take the exam, so that they know where to send the exam results to. We do have some free GRE resources on campus. So you can go to our graduate studies website. So it's www.csun.edu/graduate-studies/GRE-resources. And there might be example tests. There might be other resources, other websites, so please check it out. It's a great resource for people who are preparing for the GRE. If one is an international student, they will also might be required to take the TOEFL, right? So this is for individuals who have a degree from a non-accredited U.S. University. So they will be required to take the TOEFL. When people take the TOEFL, it's the same university code 4707. So that is something that they will add. Also, it's important to note, if someone is an international student, they have to apply through Cal State Apply in order to apply to university. Then they would have to also go to Apply Web, which is where one will apply to our program and include all of the requirements for that. But also, too, one would have to go to the main university site and apply as an international student. So there's a third step as an international student that one has to do. So if you are a non-international student, if you finish your degree at a U.S. accredited university, you only have to complete the application. Actually, let me go to the next slide. You only have to complete the application at Cal State Apply and then Apply Web. But if someone is an international student, they'll have to complete the application at Cal State Apply, Apply Web, and then also complete another third application as an international student. So I just want that to be clear. There is a third step for international students. But looking at this for students who have completed, people who have completed an undergraduate degree at a accredited university in the US. As I mentioned before, you'll have to go to Cal State Apply. That is where you will do the first step of the application, right? So then you will do the application process. You will submit all official transcripts. It's also important to note that you need to submit all your official transcripts. So let's say that you graduated at an accredited university, but you also went to a community college. Well, that means you need to submit official transcript for that college, that for your college you finished that, and your community college. Let's say a person went to 3 different universities. You have to submit a transcript from all 3 of those universities, because that is one thing that I know that typically holds up people's application process. So you want to, even if you didn't graduate from the institution, but if you went there, you should submit your transcripts to the university. So you want to make sure you could do that through Cal State Apply, where you will submit that. And if needed, you will also submit your GRE scores. And then also, if needed, you will also submit your TOEFL scores, okay? So those are things that will happen through the university. That is very different than the second half of the application. The second half of the application, you will go to Apply Web. And Apply Web is actually where you're gonna kind of officially apply to our program, the Department of Health Sciences Public Health Program. So in Apply Web, you will that's where you upload your statement of purpose. We do also have prompts online, so you can check that out. You will also upload your unofficial transcripts. So sometimes with the official transcripts, it does take quite a bit of time for it all to come through, but sometimes we just want to review the application. So submitting your unofficial transcripts really helps us kind of get an idea. We definitely won't let someone know if they're accepted until we have the official transcript, but the unofficial transcript kind of helps us, kind of helps the process a little bit better. So the goal is for you to also submit your unofficial transcript, and then also upload your CV or your resume. This is where you should be highlighting information about, what you aim to do with the program, what made you interested in public health. Don't forget to also touch on your work experience, your volunteer experience. Let's say you've never worked in public health before, but you volunteered in elements that are related to public health. Add that into your letter, add that into your resume. That really is a great way of really demonstrating that you do have some experience moving in. Sometimes we have the misconception that experience is only related to the work that you've had, or whatever job that's paid you in the past, and that's not really the case. So even volunteer experience is experience. So make sure to give the full representation of who you are professionally in your letter, and also make sure your letter is well written and that you're really communicating the best representation of yourself. And then finally, in Apply Web, you will be also adding your 3 references. You will just literally just add their name, email address, and then the system will prompt them to then complete the letters of recommendation. So you don't have to go find the letters of recommendation and then upload it for them. No, you will just put in that information, and an email will go out to your referees, and they will be able to fill out the referee form followed by their letter. And, it's important to note that with the reference component, this is an area where sometimes their application is kind of stalled. So once in a while, nudge your referees, after you've asked a little bit, maybe ask for a deadline. Do you know when you'll get to it? And also maybe put that deadline on your calendar, and then nudge them, when it comes close to that deadline that they have for themselves, or nudge them again if they have passed their own deadline, just to make sure that your application process is not stalled. In Applied Web, you can always go in and see the progress of your application. So you can see, how many referees have submitted your letter. You can see that you have 2 letters submitted and not 1 more. And that is a good indicator that maybe that is time to nudge one of your referees. The one thing about our admission process is we definitely look beyond just the GPA and GRE scores. We do also look at the bigger picture. So our program really prides ourselves as really using a holistic admission process when we are reviewing applications. So we're also looking at your personal experience. We're looking at work experience, health education work experience. We're looking at volunteer experience, your purpose, and also how you've been navigating diversity and cultural competency and personal life experiences that made you interested in public health. So, in terms of what I mentioned before, be sure to highlight this in your letter, and then also be sure to have aspects of this in your resume, because that's going to be a big part of what's going to be also reviewed in addition to your GPA and or GRE scores. So, make sure that you're giving the full picture of all of your experiences and your interest in public health, and even what you want to do after you're done with the program in terms of advocacy, in terms of work. So it's important to start thinking about what your 1-year plan is, your 5-year plan, your 10-year plan, and making sure that that's being communicated in your personal statement, and also in terms of the things that you have done, that's represented in your resume. So after you apply, hopefully things will go smoothly. As I mentioned before, you can monitor your application on Apply Web and review what the incomplete tasks are. You can see if you're missing a reference letter or if you're missing transcript. So this can be a way for you to kind of, see where your application is. And even if you're missing transcripts, maybe you want to make sure that the transcripts that you requested have been received or have been sent. So use that as a monitoring mechanism. You can check the MPH websites for any updates or any notifications. So that's up there. You also submit an application fee. I'm not sure. So I think this application fee might be anywhere from 55 to 70. Kind of heard through the grapevine that it's gone down. I wasn't really able to find anything because all that information is in the Apply Web, but it might be anywhere from 55 to 70 in terms of the application fee. But you can search the CSU website for that information. And then, of course, you want to make sure you go through CSUN admission and records and get the official, submit your official transcripts. And also make sure you submit the unofficial transcript to your MPH application. Like I said, that really helps things go a lot faster. So these are just some checklist components that you want to make sure that you do. So finally, I'm going to end this info session really talking about some frequently asked questions. So one that I usually hear is, what makes our CSUN program unique? Well, we definitely really pride ourselves that we have diverse faculty, and we really do focus on the experiences of diversity and experiences of diverse populations. And we have students who also bring that as well. Students, bring their diversity, and students that typically are in our program, they focus on diverse populations as well. And we have so many different health areas in terms of faculty too that we are all focused on. And that gives our students options in terms of working on projects, learning a little bit more about certain expertise. So all of that really makes our program really, really unique. How long does it take to finish the MPH degree? Well, for people who are full-time, it typically can take them 2 years, right? For people who are full-time and they do a thesis might take a little bit longer for some people, so it might take them 2.5 years. For people who are part-time, it might take them 3 years or 3.5 years to finish. So it really depends on, one's timeline in terms of, and also capability as well. Some people have other responsibilities such as family and work. A lot of our students work full-time, and we understand that. So that's something worth also thinking about as well. So our full-time students usually take typically anywhere from 3 to 4 classes a semester. Our part-time students may take anywhere from 2 to 3 classes. So typically that's how they navigate their classes. Another question that we get is, if you have taken public health or health education courses at another university, may you transfer the units to our CSUN degree once you're admitted? The answer is yes, but those classes have to be at the graduate level, and those classes have to be approved by the graduate coordinator. So this particular academic year would be me. Next academic year moving forward will be Dr. Spear. Students may transfer up to 9 units. So, and those are 9 units that need to be approved. So up to 3 classes. 3 classes is the maximum. So it's also important too, if someone transfers in those 3 classes, that means you can't substitute anything moving forward. So if people have classes, they can talk to the classes they take in other places. They can definitely talk to the graduate coordinator so they can understand what classes could be viable to fulfill aspects of the degree requirements. Okay, another question is, do we have any prerequisite courses that are required? No, not at all. To be admitted to the MPH program, the minimum requirement is that people need a bachelor's degree from accredited university. And we have students that come from different walks of life, different field studies. It could be humanities, it could be social sciences, it could be business. So we definitely have students who come from different backgrounds. So no, there isn't any type of prerequisites. The only prerequisite is that students have an undergraduate degree. It is preferred that students have an undergraduate degree that is health related. But I mean, and that can be a consideration with admission, but it doesn't mean that students that don't have a health undergraduate degree that they should be discouraged. We do have many students that come from different fields. The next question is, does the program offer classes that accommodate work schedules? Absolutely. Pretty much most of our classes and our core classes are typically offered Monday through Thursday from 4 to 6:45. And our electives are typically offered from 7 to 9:45. So we definitely try to have a schedule where students can still have a full-time job and still be able to participate in our program. In terms of how much the program costs, tuition changes every year, it fluctuates. So in order to do that, you can type in graduate studies or graduate study tuition CSUN, and that should be able to take you to the fee page, and you'll be able to see how much the fee costs. Well, we do not control the fees or the costs within our program. It's a university-wide decision. So if you have any questions, feel free to contact me. Feel free to look through the CSUN MPH website for frequently asked questions. Also, use the MPH application checklist. You can find this online to make sure that you are correctly going through the normative process of being able to complete the application well. And then if you have any questions, excuse me, for our in-person program, feel free to contact me. And then, of course, after January 1st, you will be feel free to contact Dr. Spear about any questions related to our traditional in-person community health education program. If you're interested in the applied epidemiology program, feel free to contact Dr. Chu. Dr. Chu's email is here. And of course, our applied epidemiology program would be in person as well. And then finally, for the online program, community health education, feel free to contact Dr. Benjamin. And Dr. Benjamin's email address excuse me, is located here. And for any other questions related to anything that I discussed, feel free to contact, sorry. For any other questions related to anything I discussed, feel free to contact the main office. The number is located here, and our main office is located in Jacaranda Hall, 2500. All right, everyone, thank you for taking time to listen to this info session. I really appreciate your time in taking time to listen through the whole entire info session. And I hope to see your applications come through the pipeline. And I hope that eventually you can make the decision to be part of the CSUN community. It is quite the community to be part of. So take care of yourselves and bye for now.